Ever wondered what lupus is and how it affects the body? Curious about the symptoms and how it's diagnosed? Interested in knowing how people manage lupus in their daily lives? Join us as we explore these questions and more. Let's unravel the basics of lupus together in simple terms. Ready to dive into the world of autoimmune health? Once upon a time in a small town, there was a lively and cheerful school teacher named Tanya. She loved her job, spending her days educating and inspiring young minds. Tanya was the picture of health, always full of energy and enthusiasm. Life was ordinary until one day, she started noticing peculiar changes in her skin, her vision blurred, and a mysterious pain emerged. Concerned about these unusual symptoms, Tanya decided to visit her general practitioner, GP. The GP, recognizing the complexity of her symptoms, recommended a visit to an endocrinologist. Driven by a commitment to her well-being, Tanya followed this advice and made her way to the endocrinologist's office. As an experienced endocrinologist, I took the time to carefully assess Tanya's condition. Various tests were performed to unravel the mystery behind her symptoms. After thorough examination and analysis, the diagnosis was revealed: systemic lupus erythematosus, SLE. Tanya, now armed with knowledge about her condition, embarked on a journey to manage and understand this unexpected twist in her life. She asked, "Doctor, what is lupus?" Lupus is a condition that causes inflammation throughout your body. It's an autoimmune disease, which means your immune system damages your body instead of protecting it. You may experience symptoms throughout your body depending on where your autoimmune system damages tissue, including in your skin, blood, joints, kidneys, brain, heart, lungs. Visit a healthcare provider if you notice new pain, rashes, or changes to your skin, hair, or eyes. Types of lupus: healthcare providers sometimes call lupus systemic lupus erythematosus, SLE. It's the most common type of lupus, and means you have lupus throughout your body. Other types include cutaneous lupus erythematous, lupus that only affects your skin. Drug-induced lupus: some medications trigger lupus symptoms as a side effect. It's usually temporary and might go away after you stop taking the medication that caused it. Neonatal lupus: babies are sometimes born with lupus. Babies born to biological parents with lupus aren't certain to have lupus, but they might have an increased risk. Symptoms and causes: what are lupus symptoms? Lupus causes symptoms throughout your body, depending on which organs or systems it affects. Everyone experiences a different combination and severity of symptoms. Lupus symptoms usually come and go in waves called flare-ups. During a flare-up, the symptoms can be severe enough to affect your daily routine. You might also have periods of remission when you have mild or no symptoms. Symptoms usually develop slowly. You might notice one or two signs of lupus at first, and then more or different symptoms later on. The most common symptoms include joint pain, muscle pain, or chest pain, especially when you're taking a deep breath. Headaches. Rashes: it's common to have a rash across your face that providers sometimes call a butterfly rash. Fever. Hair loss. Mouth sores. Fatigue: feeling tired all the time. Shortness of breath, dyspnea. Swollen glands. Swelling in your arms, legs, or on your face. Confusion. Blood clots. Lupus can sometimes cause other health conditions or issues, including photosensitivity, sensitivity to sunlight, dry eye, depression, or other mental health conditions. Seizures. Anemia. Osteoporosis. Heart disease. Kidney disease. What causes lupus? Experts don't know for certain what causes lupus. Studies have found that certain factors about your health or where you live may trigger lupus. Genetic factors: having certain genetic mutations may make you more likely to have lupus. Hormones: reactions to certain hormones in your body, especially estrogen, may make you more likely to develop lupus. Environmental factors: aspects about where you live and how much pollution or sunlight you're exposed to might affect your lupus risk. Your health history, smoking, your stress level and having certain other health conditions, like other autoimmune diseases, might trigger lupus. Risk factors: anyone can develop lupus, but some groups of people have a higher risk. Black people. Female at age 15 to 40. Hispanic people. Asian people. Pacific Islanders. People with a biological parent who has lupus. Doctor, how is lupus diagnosed? A healthcare provider will diagnose lupus with a physical exam and some tests. They'll examine your symptoms and talk to you about what you're experiencing. Tell your provider when you first noticed symptoms or changes in your body. Your provider will ask about your medical history, including conditions you may have now and how you're treating or managing them. Lupus can be tricky to diagnose because it can affect so many parts of your body and cause lots of different symptoms. Even small changes or issues that seem unusual for you can be a key. Don't be afraid to tell your provider about anything you felt or sensed. You know your body better than anyone. Which tests do providers use to diagnose lupus? There's not one test that can confirm a lupus diagnosis. Diagnosing it is usually part of a differential diagnosis. This means your provider will probably use a few tests to determine what's causing your symptoms before ruling out other conditions and diagnosing you with lupus. They might use blood tests to see how well your immune system is working and to check for infections or other issues like anemia or low blood cell counts. Urinalysis to check your pee for signs of infections or other health conditions. An antinuclear antibody (ANA) test looks for antibodies, protein markers that show a history of your body fighting off infections. People who have lupus usually have certain antibodies that show their immune system has been overly active. A biopsy of your skin or kidney tissue can show if your immune system has damaged them. Management and treatment. What is lupus treatment? Your healthcare provider will suggest treatments for lupus that manage your symptoms. The goal is minimizing damage to your organs and how much lupus affects your day-to-day life. Most people with lupus need a combination of medications to help them prevent flare-ups and lessen their symptom severity during one. You might need hydroxychloroquine. Hydroxychloroquine is a prescription antiviral medication that can relieve lupus symptoms and slow down how they progress. Nonsteroidal anti-inflammatory drugs, NSAIDs. Over-the-counter, OTC, NSAIDs relieve pain and reduce inflammation. Your provider will tell you which type of NSAID will work best for you, and how often you should take it. Don't take NSAIDs for more than 10 days in a row without talking to your provider. Corticosteroids. Corticosteroids are prescription medications that reduce inflammation. Prednisone is a common corticosteroid providers use to manage lupus. Your provider might prescribe you pills you take by mouth or inject a corticosteroid directly into one of your joints. Immunosuppressants. Immunosuppressants are medications that hold back your immune system and stop it from being as active. They can help prevent tissue damage and inflammation. You might need other medications or treatments to manage specific lupus symptoms you have or other health conditions it's causing. For example, you may need treatment for anemia, high blood pressure, hypertension, or osteoporosis if lupus causes those issues. Doctor, can I prevent lupus? You can't prevent lupus because experts aren't sure what causes it. Talk to a healthcare provider about your risk if one of your biological parents has lupus. Doctor, can you tell me, how can I prevent lupus flare-ups? You might be able to prevent and reduce lupus flare-ups by avoiding activities that trigger your symptoms, including avoiding sun exposure. Spending too much time in the sun can trigger lupus symptoms in some people. Try to avoid going outside when the sun is brightest, usually between 10 a.m. and 4 p.m. Wear long sleeves, a hat or sun protective clothing. Use a sunscreen that's at least SPF 50. Staying active. Joint pain can make it hard or painful to move. But moving and gently using your joints can be the best way to relieve symptoms like pain and stiffness. Walking, biking, swimming, yoga and Tai Chi are all great ways to move your body without putting too much stress on your joints. Ask your healthcare provider which types of activities are safest for you. Getting enough sleep and protecting your mental health. Living with lupus can be frustrating. Getting the right amount of sleep, 7 to 9 hours for adults, and reducing your stress can help prevent flare-ups for some people. a psychologist or other mental health professional can help you develop healthy coping mechanisms. Expect if I have lupus. Lupus is a lifelong, chronic condition. You should expect to manage lupus symptoms for the rest of your life. Lupus can be unpredictable, and the way it impacts you can change over time. You'll need to regularly visit your healthcare provider so they can track changes in your symptoms. You'll probably work with a team of providers as you learn to live with lupus. Your primary care provider will suggest specialists who can help with specific issues or symptoms. You'll probably need to visit a rheumatologist, a healthcare provider who specializes in diagnosing and treating autoimmune diseases. Which specialists you need to visit depends on which symptoms you have and how they affect your body. Is there a cure for lupus? There's currently no cure for lupus. Your healthcare provider will help you find a combination of treatments to manage your symptoms and hopefully put lupus into remission, long periods of time with no symptoms or flare-ups. Don't be afraid to talk to your provider and ask questions. Even small changes in your symptoms or health can be a sign that lupus is affecting you differently. Remember, you're the best judge of when something isn't quite right in your body. Tanya's journey with lupus is a testament to the remarkable resilience of the human spirit. Despite facing unexpected challenges, she embraced each day with courage, optimism, and a determination to live life to the fullest. Tanya's story underscores the importance of seeking support, adapting to change, and prioritizing self-care. Living with lupus is a continuous journey, and Tanya's positive outlook serves as an inspiration for others facing similar battles. Her ability to navigate the complexities of the condition while maintaining her role as a dedicated teacher demonstrates the strength that resides within each of us. As we reflect on Tanya's narrative, it becomes evident that with the right mindset, a strong support system, and proactive healthcare, individuals can face chronic conditions head-on and lead fulfilling lives. Tanya's story is not just about overcoming lupus, it's about thriving, finding joy in the everyday moments, and embracing the resilience that resides within us all. May her journey be a source of encouragement and empowerment for those on similar paths, reminding us that, no matter the challenges, there is always room for hope, strength, and a brighter tomorrow.